name is Rawan Albargash, and I'm going into my senior year at Basis Tucson North, and I'm currently 16 years old. Throughout the summer, my lab mentor has been Dr. Weinkoff, and our lab focuses on cardiovascular disease and Alzheimer's research. Our lab's main research question is, what is the impact of carotid disease on cognitive impairment and Alzheimer's?
This is the wet lab where Scott does a lot of hands-on work and Lily, Mohammed, and Haley do data analysis. This is the dry lab, and this is where my desk is and where everyone else's little office areas are. And this is primarily where people do data analysis. This is the lab I work with.
My lab wants to find a connection between carotid disease and Alzheimer's, as it could provide a new pathway for preventing dementia. This is because carotid disease can easily be slowed or reduced through lifestyle changes, medication, and surgical procedures. In the lab, Dr. Weinkoff and his lab members use advanced imaging and neurocognitive testing to see which Alzheimer's specific changes are associated with carotid disease. Then they want to understand how carotid disease leads to those changes, and finally they hope to identify which carotid disease treatments are effective at improving or preventing those outcomes. In the lab, I'm conducting research based on the results our patients get on the neurocognitive test that we give to them, and I'm analyzing those results to see if carotid disease affects neurocognition. More specifically, I'm differentiating between fluid and crystallized intelligence and seeing which one carotid disease affects more. The first of my research was to divide our neurocognitive tests into tests that test for fluid intelligence and into tests that test for crystallized intelligence. After doing so, I took those tests and I compared the scores that patients with carotid disease got on them and patients without carotid disease got on them, and saw if there was a significant difference between the two. Out of the fluid intelligence test, the ones with a significant difference between the carotid disease patient scores and the non-carotid disease patient scores were the MoCA attention test, the trail making test A and the trail making test B, the Benson delayed recall test, and the verbal fluency F and L. Out of the crystallized intelligence test, the ones with a significant difference were the WACE coding test, the WACE symbol search test, the MoCA delayed recall test, and the category fluency vegetable test. The test I used to determine if there was a significant difference between the scores for carotid patients and non-carotid patients was the t-test. These results show that carotid disease seems to affect crystallized intelligence and fluid intelligence almost equally. Some questions that came up during my research and that I'm curious about are, why those tests? Why were those the only tests out of the fluid and crystallized categories that actually had an effect and were significantly different between carotid patients and non-carotid patients? The next question I have is, how can I compare which intelligence is more affected? One thing we struggled with was trying to figure out how we can find out which intelligence is more effective, if it's fluid intelligence or crystallized intelligence, because now we have the scores and we know what tests are affected from each category, but we're not sure what statistical analysis we should do to effectively compare the fluid and crystallized directly to each other and see which one is actually more affected. The last question I had was, are there any flaws in my method of analysis? Are there any better statistical analyses that I could do that would be more valid or give me better answers? All in all, that's what I've done throughout the summer, and I've had a great time with my lab, and I really hope I can come back and do CME again, because this was a great experience, and I just want to thank you all for your time. Have a good day.